Good afternoon, and thank you for coming today. I want to thank Dan Pruitt back at the back and say thanks for letting us be here at Meals on Wheels and more today so that we can talk about the impact of state budget cuts in our community. My name is Suki Steinhauser, and I'm the volunteer chair of One Voice Central Texas. One Voice Central Texas is a collaboration of over 40 nonprofit health and human service organizations serving many thousands of Central Texas' most vulnerable residents. Together, our membership forms a safety net of services so that the people we serve not only survive, but thrive. One Voice members work together to ensure high standards of business operations, community oversight, and effective service delivery in order to create that safety net. We're here today to express grave concerns about impending state budget cuts. If the state of Texas moves forward with proposed massive funding cuts, our community will suffer greatly. One Voice members have over 3,000 staff, and our members actively partner with each other, the faith community, volunteers, and public and private funders to ensure that community needs are met. We also need to thank representatives of those partners like the City of Austin, Travis County, and United Way Capital Area for decades of partnership with the nonprofit community of service providers. Our community's human service infrastructure is already straining under the weight of trying to help rapidly increasing numbers of families overcome or alleviate the devastating effects of poverty. We're struggling with 14% poverty rates, 20% uninsured, and 13% low literacy rates. Further, the Austin Round Rock MSA is projected to grow by 20% in the next 10 years, adding almost 500,000 new residents, and we anticipate that the need for human services will also grow. One Voice Central Texas understands that the state has difficult decisions to make and that cuts must be made. However, the proposed state budget cuts will have a devastating impact on the most vulnerable in our community and will tear at the infrastructure of the social service community, ripping holes in the safety net itself. Examples of potential losses due to cuts to state funding include children suffering from abuse and severe mental health issues will be impacted by the reduction of over 1,000 shelter bed days at the Austin Children's Shelter and Settlement Home. 3,000 individuals will lose access to mental health services, making them more vulnerable, straining families, and resulting in lost school or work days, increased emergency room visits, and in too many cases, jail time. The homeless and those at risk for homelessness will be impacted by a reduction of more than 1.9 million of the homeless and housing services program that will result in the loss of 46 units of permanent supportive housing as well as support services. Youth at high risk of dropping out of school will be impacted by a reduction in communities and schools budget, which would be forced to cut case management services as well as emergency services to hundreds, if not thousands, of children, resulting in a spiral of dropout, unemployment, and poverty. People with disabilities face losing their Medicaid benefits, resulting in an increased risk of extreme burden to families, costly institutionalization, and health emergencies. Reduced state funding will create further food insecurity in Central Texas for thousands of individuals. You can see that the consequences of these cuts in community service will push more people into costly options like emergency hospital care and mental health hospitals. Thus, the cuts would result in cost shifting from preventive services funded by the state to more expensive solutions borne by local governments and organizations. Because the impact of proposed cuts to the state budget will be so costly in human terms and to individual communities, we're here to urge the legislature to actively seek revenue and not only plan for cuts. Again, it's important that the entire community know that One Voice Central Texas members stand together to say that we must fight these proposed cuts and ensure that we don't let go of our most vulnerable citizens. I'm going to turn this over to Debbie Brissett, who's with who are you with again? United Way Capital Area, to add her thoughts about how the private sector may or may not be able to help in these circumstances.
Thanks, Vicki. I'm here today because United Way Capital Area has always placed a high priority on health and human services as essential to the well-being of our community. In fact, United Ways are the third largest funder of health and human services behind state and federal funding in the nation. And in Texas, United Way's raised $250 million over this last year to invest in health and human services. Texas was the largest state in the nation to raise that much money. And we have a budget shortfall of $27 billion. There is no way that the United Ways and local nonprofits can make that difference. We are focused on the areas of education, income, and health. United Ways across the state are, because those are the building blocks of a thriving, creative, and innovative community. And they're critical areas, and they're facing some of the largest cuts. We're asking our elected officials to please protect the well-being of our community, to help us urge, we'd like all of you all, we want to ask everyone to help us urge the legislature to make decisions that place the future of our community and its most vulnerable citizens first. Because a cuts-only approach to this challenge is no solution at all.
Hi, I'm John McNabb with Vaughan House, but we're also chair of the public policy, co-chair of the public policy committee for One Voice. Basically, what I want to do is to talk about what we request from our legislative folks and in the tough decisions they have to make. I guess when it comes to how do we fund what services we can provide. And as they make these tough choices, the first thing we want to do is ask them not to do any harm. And the best way to do no harm, of course, is to consider the negative consequence of change. Before the decisions are finalized, we hope they analyze the impact and the consequences of reduced funding to any of the service agencies. And if we're going to have to make those cuts, how do we mitigate the impact of those cuts? Secondly, we recommend that they support programs that are cost effective. They have a track record of success. And they are cost effective in terms of you're not going to require jail diversion. You will help with workforce development, and you will help with behavioral and mental health programs to keep our citizens as independent as possible. We ask them also to support programs and nonprofits that demonstrate success. There's a huge economic strength in Central Texas because of the vitality of our nonprofit community. We can't afford to cut that strength, certainly not in these times. So we ask them to consider all revenue options to ensure that adequate and equitable revenue is available so that vulnerable Texans will have access to services. We really can't go into this challenge with one arm tied behind our back. We need everything on the table. We need to make sure that we look seriously at the rainy day fund. We need to make sure we don't leave federal dollars on the table, and we certainly have to fund programs to a minimum level to make sure that we don't get zeroed out on federal funds. And the biggest thing, I think, is we don't want to do anything that results in nothing but cost shifting. There is no excess capacity at the local level, as Debbie just described, to make up any gaps in service funding that we know must be done. And what we worry about is what's going to happen on top of whatever state cuts come in when we know the federal cuts are right behind it. Fundamentally, though, we ask the legislature to seriously consider the structural deficit that we face. This is one budget cycle. There's another one coming. There is no more stimulus. There is no more IRA. The federal programs are being cut, and we know we have a structural deficit. We need to seriously acknowledge it and work it. And lastly, we would hope that the legislature continues to have transparency in this process. It's too important. One Voice recognizes the difficult decisions that are going to face our legislature, and we would like to help. We will provide experts, and we will speak to the challenges and explore the solutions if they need them. Thank you.
Thanks again for coming today. Some of our membership will stick around to answer questions. We all have to go out and advocate and make sure that the most vulnerable in our community continue to get the services that they very much need.